Hey, thank you so much for clicking on the video and wanting to learn more. As promised, here's how regenerative PRP injections or platelet-rich plasma can help with your chronic pain. I know your time is valuable, and I'm here because I believe your health deserves the same attention, care, and dedication as everything else in your life. So let's get into it. I most recently worked with Team USA Weightlifting as the team physician. The experience has taught me to be resourceful and efficient in how I treat the athletes. Being a double board certified family and sports medicine physician with years of experience helping patients just like you overcome pain and reclaim their health, my goal has always been to provide the kind of care that I would want for my own family. Personalized, compassionate, and focused entirely on what you need. So who is this video for? This video is for you if you're frustrated with chronic pain that you've been dealing with for an extended period of time. This could be pain that has persisted over months or maybe even years. Here are some of the treatable conditions that we may be able to address. Things such as hip arthritis, shoulder arthritis, knee pain, joint injuries, or even chronic tendonitis. By the end of this video, you'll understand what PRP is, the potential benefits of PRP injections, and where to get them. So, what is PRP? PRP is exactly as it states, is platelet-rich plasma. It is your own blood that is spun down by a special type of centrifuge that basically concentrates the platelets in your own plasma down to a therapeutic level. Well, why are we trying to get these platelets? Well, the platelets themselves are these little things that float around your blood, and whenever you get injured, they go to these areas to promote healing. Well, we have taken the same idea and thought process to now not just repair things like, for example, when you get cut, but we want these platelets in areas where we do want healing to occur. And so now we are using them for, again, conditions such as arthritis or chronic tendonitis, where there may be some non-healing injury in the area. Platelets themselves, how they work is they contain two things that we care about. Number one is growth factors, and these are exactly what they sound like, things that help promote growth such as blood vessels and new tissue in the area that may be damaged. Number two, the other aspect is that it decreases inflammation for these areas that may have a lot of it. For example, arthritis, usually for most people that experience it, will notice that the area that is that has arthritis feels warm, hot, swollen, really inflamed. And so the platelets provide an anti-inflammatory effect to that area. And so that is why we are now using this form of therapy to hopefully induce healing and reduce the amount of pain. Now, to speak about how this can be helpful, we did have a recent patient success story at our clinic where the patient was able to make a full recovery of his chronic shoulder pain through PRP injection therapy. And this is essentially after 1 month of treatment. This is what we provide, and that's what this video is about. But let's take a step back for a moment and talk about why PRP hasn't been accessible until more recently. First of all, why doesn't my insurance cover PRP injection therapy? Now, to everybody's benefit, it is not essentially that insurance is evil and whatnot and doesn't want to cover this medication or injection therapy. PRP is not standardized at this point in time. There is no specific guideline as to how PRP should be processed and made. Although we do know certain aspects and qualities to PRP that do make it more effective, such as the PRP needs to be 6 to 8 times more concentrated than the typical levels in your own blood, not less. Additionally, there is no standard PRP machine to process this. There are many manufacturers, and thus, because it is not standardized, it is not yet covered by insurance objectively. When should the treatment be considered as a solution for you? So, in regards to PRP injections, number one, the most commonly one we'll see is for osteoarthritis. When I say arthritis, it is a chronic degenerative condition for the knees or shoulders or other parts of the body, and that's where we see it used most often. The second most common other area that we may see it is used for tendons that have chronic tendonitis. Now, this may include things such as tennis elbow, golfer's elbow, or even rotator cuff tendonitis for the young and the more advanced age. And these are the typical conditions that we'll use PRP for. Now, there are other indications. Sometimes we may use PRP injection, sometimes as a last resort prior to doing surgery. PRP itself is relatively non-invasive. It is done in the office under an ultrasound-guided needle that is placing the PRP directly where the injury is, and then you're in and out of the office literally within 5 minutes after the procedure is done. There's no downtime, and we are hoping that it is a longer-lasting solution that could help either avoid surgery or negate it completely. So this is why PRP may be a solution for you if you're wishing to avoid surgery. What to expect after getting the treatment. So PRP is not a pain-relieving solution in the traditional sense. It is not injecting a numbing medication nor steroid that you may be more familiar with. PRP, after the procedure is done, you are trying to induce growth, new tissue being placed in the area of damage. This takes time, sometimes days to weeks. Generally, we say to re-evaluate PRP after a minimum of 6 weeks. During this time, while new tissue is growing, we are wanting to make sure that that tissue is also strong and growing the way it should be. Thus, it is usually followed by a course of physical therapy directed at the area. So, in the end, PRP is not a quick fix. It is meant to be of a slower but longer lasting solution for chronic pain. If you're ready to take that next step, we'll schedule an introductory call to discuss your needs and see how I can help you achieve your goals. Schedule a call below.